folks like yourself, physicians and nurse practitioners all over the country, and I was trying to recruit them to our practice. And the number one piece of feedback that I got during that time was from providers that would say, hey, I don't want to join another telehealth company, but how do I do what you're doing for my own practice? The story of Klinic and how we got started. I had a good friend at my last company who struggled with addiction. He lost his insurance. He had a lot of substance abuse problems. I personally had to go and take him into the hospital multiple times. I had to check him into multiple different treatment centers over the course of years. This is my introduction into healthcare, by the way. So I would personally call these treatment centers, figuring out, do you accept this insurance? Do you have availability? How far are you? I would kind of help him go into this. So when I was thinking about starting Klinic, the initial thesis of the company was I wanted to build a telehealth practice. I wanted to do this where we do addiction and psych and mental health online. So I partnered with a psychiatrist named Anil Irsani. We got started with Klinic in early 2021. The way we got started is we ended up raising some money and hiring a bunch of engineers, and we started to build a bunch of software integrations together. And we launched towards the end of 2021. It took about 6 months to glue and stitch together our telehealth platform. It cost about $1 million to build out. And we launched and we started to grow. I would jump on these Zoom calls with folks like yourself, physicians and nurse practitioners all over the country, and I was trying to recruit them to our practice. And the number one piece of feedback that I got during that time was from providers say, hey, I don't want to join another telehealth company, but how do I do what you're doing for my own practice? And I started to realize that there are a lot of independent practitioners around the country that want to be in private practice. They want to grow their own private practice. They want the autonomy of working for themselves, but they don't have the tools or the resources to raise money and hire engineers and build software integrations and hire a marketing agency and hire a billing company and hire care coordinators to acquire patients the same way that a venture capital-backed startup could, or the same way a private equity-backed medical group could.